Hello, I'm Lieutenant Finnerty from the Anatomy and Physiology branch of the A-Med Center and School. Today we're going to discuss the anatomical structures of the respiratory system. We'll break the respiratory system down into an upper respiratory tract and a lower respiratory tract. The upper respiratory tract will include the nasal cavity, the pharynx, and all associated structures within this area. The lower respiratory tract will include the trachea, the bronchi, the bronchioli, and the alveoli. We'll start out now with the nasal cavity. The nasal cavity is divided by the nasal septum. The nasal septum separates the cavity into a left and right half. It's constructed of cartilage and bone. The concha, meatuses, and olfactory bulbs are all located within inside the nasal cavity. The nasal cavity is lined with a mucous membrane. The mucous membrane is composed of a pseudostratified ciliated epithelium rich with goblet cells that secrete the mucus. As the air enters into the nasal cavity, it is disrupted by three concha, an inferior, a middle, and a superior. This disruption causes the air to whirl around. As the air whirls around, it is conditioned. It's warmed by the superficial blood vessels that are surrounding the concha. It is moistened by the secretion from the goblet cells. It is also filtered by the secretion from the goblet cells. The last function of the nasal cavity is to test the quality of the air in the superior portion by the olfactory bulb. The olfactory bulb will initiate a severe sneeze reflex if any irritants come into the nasal cavity. This will prevent them from going further down through the system and causing damage. The conditioned air will travel posteriorly through three meatuses and continue on through its journey. We will now discuss the four paranasal sinuses, the frontal, maxillary, sphenoid, and ethmoid sinuses. These are small projections inside the bone that help to lighten the skull and also act as a voice resonance chamber. They are covered with a mucous membrane that oftentimes is filled up and causes a sinus headache. We will now review the functions of the nasal cavity. The air is moistened and filtered by the secretions of the mucous membrane. It is warmed as it passes over the superficial blood vessels. And finally, it is tested in the olfactory bulb in the superior region. We will now go to the pharynx regions. The pharynx regions include the nasopharynx, the oropharynx, and the laryngopharynx. The nasopharynx is located from the end of the concha, or the back portion of the nasal cavity, to the tip of the soft palate called the uvula. Within the nasopharynx, there are two structures you need to be familiar with. The first is a lymphoid tissue called the pharyngeal tonsils. If this is inflamed, it's called the adenoids. The second structure is a eustachian tube or auditory tube. This relieves pressure from the middle ear. From the nasopharynx, we then go down to the oropharynx. The oropharynx is located from the tip of the uvula down to the hyoid bone. If the epiglottis is open, it is from the tip of the uvula to the tip of the epiglottis. Inside the oropharynx, there are two structures you need to be familiar with. These are both tonsils. The first tonsil on the lateral wall just past the uvula is the palatine tonsil. The palatine tonsil is a tonsil that is most often removed. The next tonsil is the glossal or lingual tonsil that is located at the base of the tongue. The final pharynx region is the laryngopharynx. The laryngopharynx is from the tip of the epiglottis if it is open, or the hyoid bone if the epiglottis is closed, down to the inferior cartilage called the cricoid cartilage. The laryngopharynx includes the esophagus posteriorly and the larynx anteriorly. The larynx is composed of 9 cartilages, 4 of which you will need to know. These are the thyroid cartilage, the cricoid cartilage, the arytenoid cartilage, and the epiglottic cartilage. I'll now show you these on the model. The thyroid cartilage is a large superior cartilage that has a notch in the middle. The notch is referred to as the Adam's apple. It is a good reference point for you. The base or the inferior cartilage is the cricoid cartilage. Posteriorly, we have 2 paired cartilages called the arytenoid cartilages. The arytenoid cartilages sit on top of the cricoid cartilage. The arytenoid cartilages are movable and thus move the vocal cords by intrinsic muscles, causing the pitch of your voice. The final cartilage is a superior cartilage called the epiglottic cartilage. The epiglottis sits on top of the glottis and prevents food from entering into the air pipe. We will now discuss the soft tissue structures of the larynx. The soft tissue structures include the cricothyroid membrane, the thyroid membrane, and the vocal cords. We'll now show these on the model. The cricothyroid membrane is located between the cricoid cartilage and the thyroid cartilage. This is the membrane that is used for emergency airway inundation. The thyroid membrane is located between the thyroid cartilage and the hyoid bone. We're now ready to begin with the lower respiratory tract. The trachea extends from the inferior portion of the larynx approximately 4 to 5 inches to the carina. It's composed of 16 to 20 C-shaped cartilaginous rings sitting one on top of the other. They are lined with the ciliated mucous membrane that will expel any irritants that make it down this far. The inferior portion, or the carina, is a specialized area that will initiate a very strong and violent coughing reflex if any irritants happen to make it this far. From the carina, the trachea bifurcates into the bronchial tree. The bronchial tree consists of the primary bronchi, secondary bronchi, and tertiary bronchi. The right primary bronchi is steeper and more acute. The right primary bronchi is the area where most times you'll have a lodging of a foreign substance if choking occurs. From the primary bronchi, we now go to the secondary bronchi. You have 3 secondary bronchi on the right lung going to the 3 lobes of the right lung. You have 2 secondary bronchi on the left lung going to the 2 lobes of the left lung. The tertiary bronchi are depicted by the black and gold circles. You have 10 tertiary bronchi on the right lung, and you have 8 tertiary bronchi on the left lung. These tertiary bronchi are going to the segments of the lung. From the tertiary bronchi, we now go to the bronchioli, level 3 through 19. The bronchioli have no cartilage in them. They are strictly smooth muscle. This is why they are able to collapse during an asthma attack. From the bronchioli, we go to the terminal bronchioli at level 20. From the terminal bronchioli, we go to the respiratory bronchioli at level 21. We then go to the alveolar duct and atria, and ultimately to the alveoli. The alveoli is the area where the gas exchange takes place. Although very small and very thin, the alveoli represent approximately 75 square meters if laid out on a smooth surface. The alveoli is the area where the CO2 and the O2 are exchanging. The lungs are light elastic tissue that are the housing for the alveoli and the blood capillaries. The right lung is separated into 3 lobes. It's separated by an oblique fissure and a horizontal fissure. The left lung is separated into 2 lobes, and it's separated by an oblique fissure only. The right lung has 10 segments depicted by the different collars. The left lung has 8 segments and is also depicted by the different collars. The lungs are protected and solidified by the rib cage. The first 7 ribs are the true ribs because they articulate with the sternum. Ribs 8, 9, and 10 are your false ribs because they articulate with the cartilage above them. Ribs 11 and 12 are your floating ribs. They articulate with nothing. The diaphragm is the primary muscle involved in the inspiration process. It's responsible for 75% of the airflow into the thoracic cavity. The external intercostals also aid in the bringing of air into the thoracic cavity. During active inspiration, the sternocleidomastoid, the scalenus, and the pec minor also aid in increasing the thoracic cavity size. During expiration, the diaphragm naturally will relax and push the air out of the thoracic cavity. During active expiration, the internal intercostals will pull the rib cage down and help force the air out at a quicker pace. The lungs have 2 blood supply systems, a nutritive supply system and a functional supply system. The nutritive supply system gives oxygenated blood to the structures within inside the mediastinum, the pleural membranes, and the lung tissue itself. The functional blood supply is coming to the lungs to be oxygenated. It comes to the lungs via the right atrium, drops into the right ventricle, and exits via the pulmonary trunk. The pulmonary trunk goes to the lungs via 2 pulmonary arteries. The pulmonary arteries branch into capillaries and return back to the left atrium via 4 pulmonary veins. The pulmonary veins bring the oxygenated blood into the left atrium. The left atrium then drops into the left ventricle, and the blood exits via the aorta to go through systemic circulation. We're now ready to recap the anatomical structures covered today. We began in the nasal cavity and worked our way down through the pharynx regions. From the pharynx, we went to the lower respiratory tract, to the trachea, and all the way to the alveoli. From the alveoli, we discussed the musculature involved in the respiration process. We also discussed the blood supply coming to the lungs.